Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. When I began to work in this field, I quickly realized that school didn't teach me enough about tongue tie. I wanted the opportunity to learn firsthand from an experienced professional. I had so many questions. Can you relate? Good news. I've created the Professional's Guide to Tongue Tie in the Breastfeeding Infant just for you. You'll get 4 recorded video modules, downloads to share with your patients, admission to a thriving multidisciplinary community for networking, sharing, and continued learning, and 4 LSERPs. All the details are on the website at tonguetieexperts.net/pro course. Use code PODCAST15 to save 15% off this and all of my courses. Can't wait to see you in the group. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hi, everyone. Welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Palladino, and today I'm sharing what was a thrill for me. I'll tell you a little story. For those of you who know me in real life, I'm a huge baseball fan, particularly the New York Mets. So, imagine my excitement when I found out that one of my favorite players, Francisco Lindor, had a wife who had a podcast about parenting. I took a chance, I reached out, and Katia Lindor was gracious enough to have me on her show. I loved our conversation so much that I decided to share it here with you as well. The podcast that she has is called the Unapparent Podcast, and it's all about the journey of starting parenthood and how things happen that you don't expect. And it's really interesting because it's bilingual. So one episode is in English, another in Spanish. Mine was in English because I'm not that confident with my Spanish. I hope you'll enjoy this recording. And I just want to say I'm so grateful for Katia Lindor for having me on her podcast and for agreeing to let me share this with you. Let me know what you think.
Hello, everyone, and welcome back to another episode of the Unapparent podcast. Today, we have a very special guest. Her name is Lisa Palladino. She is an international board-certified lactation consultant / certified nurse midwife in Staten Island, New York. Lisa's almost 35-year career includes 28 years of hospital experience, first as an RN, then as a CNM, and finally as an IBCLC. While at the hospital, Lisa worked for 8 years in collaboration with NYC Breastfeeding Initiative on efforts to achieve baby-friendly status. In 2015, Lisa founded her private practice to provide for women's lactation, nutrition, and wellness needs with an approach that integrates the midwifery and functional medicine models. Currently, Lisa manages the Tongue Tie Experts brand on Facebook and Instagram, provides education to parents and professionals through social media outreach and courses, and produces the Tongue Tie Experts podcast. She loves to lecture and educate the world on the importance of breastfeeding for the health of infants and the developing airway. She is the author of the book, It Shouldn't Hurt to Nurse Your Baby, Healing the 6 Most Common Causes of Nipple Pain. So here's Lisa. Thank you, Lisa, for being on our episode today. It's such an honor to have you. I've introduced you professionally, but if there's anything you want to add on a more personal end or anything I missed, you have the floor to do so.
Yeah. Thank you so much. It's a pleasure and honor to be here as well. And I always get a little tired after hearing my professional bio. Wow, that's a lot, right? But most importantly, I'm a mom. You know, there's nothing more important than that. I'm a mom myself. And a godmom. I've raised 7 kids because I had 3 of my own, but my sister passed away very young and left 4 very young children. So I helped raise them. So I'm blessed to have a big family. And I recently became a grandma. And I like to integrate my experience with my education, you know, because we can learn everything in the books, but it's personal experience, you know, dealing with other, you know, families and moms and babies and all that. But we always bring our own experience to the table as well. And I'm turning it into, as I'm in my wisdom years, I like to call it some wisdom, right? And I'm also happily married for so many years to my college sweetheart, which is kind of miraculous in itself. And I'm blessed for that, yeah. And I am like a crazy New York Mets fan, which is how I, you know, initially discovered that you had a podcast because I followed you through that. And that's about me personally.
Awesome. Well, you sound like you have so much that we can learn from. So you're, I don't even know where to start. There's so many things we could talk about, I'm sure. But I guess we'll start with your breastfeeding expertise, since this is what it's about. And obviously, I want to just throw out there that I know that breastfeeding perhaps is not for every mom, in the sense that maybe it's not the right thing for them at any given time. I know some moms who feel shame for not having breastfed their kids, whether it's because they weren't able to, they didn't have the proper education at the time. For whatever reason, that's a personal choice. I personally full-heartedly went into my breastfeeding experience. It was something that was really important for me from the get-go. Like, the one thing I was like, yeah, I hope my birth and delivery goes well and safe and my baby's healthy, but the next most important thing for me was being able to nurse my baby. So this second time around, I hope the same. And so it'll be great to hear, you know, from you firsthand also. So
Yeah. First, I'd like to say, of course, sometimes lactation consultants get a bad rap as like I've heard phrases that I won't even repeat about how militant we are about breastfeeding. And that's not the case. My goal isn't to make anybody breastfeed who does not want to. My goal is to help families to reach their own breastfeeding goals or their own infant feeding goals. And sometimes that's mixed feeding. Sometimes it's exclusive pumping. Of course, I'd love it always to be everybody feeding at the breast, but I realize that's not always possible. And, often we have the best goals, but the other issue that we don't talk about too much with pregnancy, which is why I'm so glad I'm here, is preparing for breastfeeding. We need to talk about the things that can stumble in our paths that are going to make breastfeeding difficult and what we can do about it. And I like to talk about that before the baby comes so that everybody doesn't just have that like Madonna picture of the mom holding the baby and everybody's smiling and everything is perfect and easy, because it's rare that it is perfect and easy. And the other thing that I just want to say is no shaming, of course, because I don't do this work because I got it all right. I've told my own story on my own podcast about how wrong I got my 3 different nursing experiences. I wish I could go back. And I think one of the things we're going to talk about is how the healthcare system doesn't always support us. And I was a perfect example of that. I was already a nurse when I had my babies, and I knew so little about breastfeeding. So I don't do this because I don't ever want to be preachy, oh, you should do this because this is the right way. Absolutely not. You should follow your heart, get the most support for what you plan to do ahead of time so that you have the resources if you need help.
Right. Yes. Thank you for that.
Yeah.
And so in I guess a preventative way, or just kind of in a way to prepare, how would you recommend new moms or even second or third time moms go into their pregnancy if they want to breastfeed, kind of preparing for that? What would you say in that respect?
I think that the most important thing to do is to establish a relationship with an IBCLC. And most people don't even know what an IBCLC is, an International Board Certified Lactation Consultant. And the whole lactation field can be very confusing because there are so many different initials that describe different types of lactation care. There are CLCs, IBCLCs, CBCs, CBEs, there's all kinds of initials, right? But an IBCLC is the highest level of education, the highest stringent regulation on using the title, and the certification is difficult. It takes lots of years of education, many, many hours of experience learning from another IBCLC, and sitting for an exam. And we have to re-examine every 10 years, every 5 years with education. And up until just this past year, every 10 years we had to retake the exam. So it's very stringent and it's like the gold standard. So you can get lots of help from other lactation professionals. But if there's ever going to be a problem, you want to get the best care that you can, the highest level if possible. And we're all over the place. We're worldwide. The problem that sometimes happens is IBCLC is a rare, it's not going to sound like it's a new profession to you because it started in the late 1980s. So to you and your younger generation, that sounds like a long time ago. But when you think about, how long have there been doctors and dentists and, nurses, it's been so much longer than that. So it's a relatively new profession. So not all medical professionals know that we're out there, right? So I would say that getting back to what you can do, first establish a relationship. Find someone in your area. See if they give classes. See if they have something like, I like to offer a package, that's like one visit before, that's like a class, and one visit immediately following the birth, and then keep in touch with the mom during the early days so that the relationship is already there. right? So what I see with a lot of new moms is they think they've taken a breastfeeding class, or they might have done something online, which is fine. But then when you are in that first, second, third postpartum day, and you're overwhelmed and feeling a little hormonal and tired and in pain, and you remember all those, that those first few days can be a little bit overwhelming. The last thing you want to do is have to start like Googling and making phone calls and finding someone.
Right. At that point, you're like so over feeling that way that if you didn't have that pre-established relationship, it's really tedious to like begin searching for that point.
Exactly. And for the first time mom, that class or that meeting will hopefully include troubleshooting. I like to talk about being a little bit like, let's talk about what could go wrong, which sounds terrible. But if we talk about what's going to go wrong, then we can have solutions ready for when they do. Like, for example, say you're planning a beautiful vaginal birth and it turns out to be a C-section, right? Necessary or not, it's a C-section. What do you do now differently than you would have done? How are things different for you? How are things going to be different for the baby? How are you going to, manage the maybe being more uncomfortable, maybe having more separation from the baby than you planned. So going through all those things and being prepared for it. And I also like to talk about what is going on and what to expect those first few days that's realistic and safe compared to the goals of the actual hospital, right? Because the goals of most hospitals, there are places that are doing this beautifully, but in most cases, the goal for the hospital is just to get you and the baby home as quickly as possible, having that baby regain weight. It doesn't matter to most hospitals how that happens, right? They don't. This is why there's a little bit more of pushing a formula on newborns so that it looks like they're gaining weight, they're making diapers, and they can go home, right? For that normal, healthy baby I'm talking about. So there are ways to know when is supplement necessary, when are there other things you can do besides giving formula, and what you can do to make things go as smoothly, and when you need to reach out for help. For example, when you should start hand expressing or pumping if you need to. These are all things that we should be talking about during pregnancy,
right?
Not after the baby comes.
So many of you have asked what to do to prepare for frenotomy that I decided to share part of my Parent's Guide to Tongue Tie with you for free. The Preparing for Frenotomy checklist is one of the most popular with parents and professionals. The day can be stressful, but if you are ready, everything can go smoother and you will feel calm knowing that you are prepared. You can download this free checklist at bit.ly/readyforfrenotomy. You can find this link and other links to all of my courses and freebies in the show notes. I hope you find this helpful.
Yeah, I remember for me, since I had the experience of having a home birth, I had...
Oh, I didn't know that. I love that.
Yes.
I had a home birth too.
Well, I had a home birth and I'm planning a second home birth. So
Beautiful.
Hopefully everything goes according to plan. But the first time around, right, my midwives knew that was just so important to me. I wanted to nurse, and that was the experience I had, and it was beautiful because everything happened, pretty seamlessly for me. Yes, of course, I had the nipples crack, and it was painful, and I just had to push through the pain. But I didn't have a problem with production. I know that's something that a lot of women experience. I felt like I was a human cow. And my baby, she doubled her birth weight in the first month, which was incredible.
Wow.
She was pretty small. When she was a couple weeks early. So she was a small newborn. But she just latched, and it was just constantly nursing, right? So I don't know how much of that was just like, serendipitous to happen as the stars aligned for me in that way. But But since I didn't have the experience of a hospital birth, and I think a lot of women who listen to my podcast do, what would you say it is about hospitals that they don't properly support women who want to breastfeed?
So again, I don't want to disparage all hospitals because there's some that are doing this really right and are supportive. But even in the best case, I was a lactation consultant in the hospital, and I was there to oversee maybe 30 women in a day, and you can't give a lot of attention if you have to help 30 women breastfeed their babies.
Right.
So you're not getting, even if there is a lactation consultant for you, you're not going to get a lot of one-on-one time with them. And they're often very stressed. I'm speaking from past experience because there's so much to do. It's perfunctory at best, and sometimes it's even... It would break my heart when I hear people say, oh yeah, the lactation consultant came in and said everything was okay. Because the lactation consultant didn't really have time to see that everything was okay. So now mom thinks she doesn't need a lactation consultant. She's just failing on her own because we always blame ourselves, right?
Yeah.
So it's kind of that, or you have the... I'm going to talk a little bit about formula. And again, I'm not anti-formula. Thank goodness we have formula. But the way that the industry is set up in our country, especially, is that a lot of institutions, a lot of hospitals have been getting support from formula companies for years. When I was a new nurse learning about taking care of new babies, I was trained by formula company representatives. Formula companies gave the hospital money to build the nursery, right? So there's a little bit of bias going on there, right? So if there's well-meaning lactation consultants or nurses who are saying, we want to be baby friendly, and I don't know if we could talk a little bit about what that means, and then you have the administration saying, wait a minute, we're going to piss off the formula company. And they're supporting us. So what do we do? That's one on the administrative level of hospitals and structure that happens. And there's an underlying current of conflict between those who want to help people to establish breastfeeding and those who don't really care that much because it's not going to make them any more money, right? Which is kind of shameful. The baby-friendly initiative, one of the things about that is hospitals have to pay for formula. And historically, hospitals got formula free. And that's why part of the reason why there's a monopoly from certain companies. Everybody's using either one brand or the other because the hospitals take turns giving out one or the other brands because they're getting it for free. So it's, essentially free advertising.
Right.
Free marketing, right, to this captive audience. And we just got used to that as a culture to get the free formula. I worked at the hospital and I thought it was wonderful that we could give gift packs of formula out to moms as they were going home. And how wonderful is it that there was a little teddy bear in the pack and all that stuff, right? However, as I woke up and educated myself more, I realized the harm in that. And if somebody wants to exclusive breastfeed, and there's formula in the room, or they go home with a formula gift pack, they are like 50% less likely to exclusive breastfeed. Because if the formula is there, they're going to use it. Because of those times when it gets challenging and you're like, wait, I need to try something else. Or your doctor says, oh, why don't you try formula? And even though you wanted to nurse, everybody's making you feel like you're not doing a good job. You're going to go for the formula,
Yeah,
because it does get challenging. You're very lucky, but I'm going to just go back to your story a bit.
Okay.
Because if you had cracked and bleeding nipples, I don't want anybody to think they should push through that. There's things to do about it. The early days should not hurt. There's things to do with positioning. There's things to do with the way the baby is holding its mouth and stuff like that. So I'm sorry that you had pain.
It was, totally worth it for me to push through it. I know I was told, I had a good support system, and my midwives are amazing, and they did tell me, it's not supposed to necessarily, like hurt. And they did explain about the latch and the proper way that the baby should latch. I think it was partly obviously me being a first-time mom, and my baby being so small at first. She had a very tiny mouth, and this might be TMI, but I didn't have like the largest nipples, and so I don't know. It was something about just the way she latched, and I could see what they were saying about how like it needed to be, a more like open latch. But it didn't seem to be affecting her feeding, like the amount of milk she was getting. It was just affecting my body.
And sometimes all it takes is 1 or 2 nursings in a bad position to crack your nipples. And then if you keep doing it, it's going to continue. So sometimes if I have somebody in my office who's got sore nipples like you're describing, and I just like tweak a little bit, like, what if we just did this, and then all of a sudden it's like, oh yeah, it doesn't hurt anymore, and the nipples heal within 24 hours, that's one. I mean, our bodies are amazing, right? Like how they can heal and what they can do. And I'm always amazed at how our bodies work so wonderfully to support our babies most of the time.
Yeah.
And the other thing that you spoke about was your copious milk supply, which is wonderful. We're not always that blessed, but it might have been, give yourself some credit, because the more the baby nurses, the more milk you make, right? So you were so dedicated and probably had her latched almost continuously.
Constantly.
And she was like, wanting to grow so fast. Her instincts were to just nurse and nurse and nurse, and that will bring on more milk. So one of the interesting points that we don't always know is the more you nurse, or the more milk is removed during the first and second days after birth, the more milk you make at 6 weeks. So that's why one of the things that I teach is, if you aren't able to nurse for some reason, or the baby's having difficulty latching, or you have to be separated, you need to start expressing milk, whether that be hand expression or pumping, but we need to start telling the breasts that, yes, you do need to make milk. We do need this milk, and get into that pattern of, as I call it, demand and supply.
Right.
The more we demand of our breasts, the more milk we make, right?
Yeah, it makes sense. And that's why I didn't pump for a long time, because I didn't need to be separated from her. I count my blessings for that every day, because breastfeeding was so important to me. And so I didn't want to overproduce, because it was on demand. She was every time she latched, and I was already producing quite enough for her. I didn't want to overproduce and then feel the need to then pump and be so engorged that I was, uncomfortable and all of that. So yeah, I know that's maybe not everyone's experience with the production and the latching. And that's another thing I wanted to ask you about. You do specialize in tongue tie, correct? And I don't know if everyone is educated in what that is, how to identify it, and how to kind of solve it. I think the belief is that if you have a tongue-tied baby, they can't nurse, they can't latch.
Right. Well, some babies with a tongue tie will latch, and some will latch and cause a lot of pain that doesn't ever get better. Yours got better. Sometimes it will get better, but other things happen, like milk supply goes down, or you'll have a baby that is nursing all day long, never is satisfied. Is nursing all day long, never is satisfied, and doesn't gain weight? Is it making diapers? Signs that they're not transferring milk, even though it looks like they're nursing, right? So you have the babies that don't latch, you have the babies that latch all the time and are always upset, no matter what. But just for some definitions about tongue tie, because I know a lot of people don't completely understand. Tongue tie means, we have what's called frenum in our mouth. And the frenum can be under the tongue, can be at the lips, both lips. There can be frenum in here. And the frenums are normal, but if they're too tight or in a position that prevents normal movement, then we call it a tie. So you can have a lip tie or a tongue tie or buccal ties, which are cheek ties. So if the baby can't lift their tongue up to a way, so to nurse, a baby has to open their mouth really wide and lift their tongue with the mouth open. So if the tongue can't go up with the mouth open because there's a frenum holding it down, when they go to lift their tongue, they close their mouth and pop off or have a very shallow latch and cause a lot of pain and can't effectively nurse. So one of the things that I like to say, if it's in your case, everything settled itself out and it was probably a positional thing. I think that if there was a tongue tie there, other things would have come up. But if you have pain in general, or it's worth getting checked out, because pain that mom experiences is a sign that the baby's having a hard time or the baby's not nursing efficiently. So we don't want it to just all be about mom pushing through if things are really bad, because that you want what's best for the baby too. So we don't want to, we tend to martyr ourselves as mothers from day one, right? Mm-hmm. But you want to consider that it could be a sign that the baby's struggling. So other sides of tongue tie is if the baby's not getting a really good latch and not lifting their tongue, they can swallow a lot of air. And when babies swallow a lot of air, it's got to go somewhere. And sometimes that comes out as spit up or reflux. Sometimes it causes GI distress or a lot of gas pains or colic symptoms. And sometimes it causes, again, a little bit gross, but explosive bowel movements, right? Diapers that you can hear them across the room, or they're like explosive, and sometimes they're more odorous than you'd expect a baby to have. That's not always a sign of tongue tie, but tongue tie should be ruled out if that's happening. But reflux especially, a lot of spitting up warrants an examination by someone who understands what they're looking for. And that exam should be a functional exam. So if breastfeeding is the function, it should be someone who can evaluate your breastfeeding. Again, back to an IBCLC. Mm-hmm. If it's an older child, because sometimes older children, it gets past childhood or past babyhood, and it's an older child having trouble with their function of their tongue, then it would be someone who can evaluate that function, whether it be a speech-language pathologist or a feeding therapist who understands how the tongue moves and how that affects speech and feeding.
Okay. And is there any element that is genetic? Like, can it be, if one of the two parents had it, could that potentially...
It's possible.
Mm-hmm. Okay.
There's a lot of, musings about what's causing this and why is there seeming to be more tongue tie now. One of the things that I know to be true is that, thank goodness, this generation, your generation, is nursing more. So tongue ties could go under the radar if you're bottle feeding, because it's easy to force a baby on a bottle where you can't force a baby on a breast. You never want to force a baby on a breast.
Right.
So we can have tongue ties that are missed because of bottle feeding. So now that more people are breastfeeding, there's more problems with breastfeeding. And instead of giving up, people are getting evaluated, right? Mm-hmm. So that's why we're finding more. The other thing is that one of the people that does research in this area is an anthropologist who's a dentist. And he's been examining skulls of prehistoric, pre-industrial skulls up until now, and realizes that, one of the parameters of having a tongue tie is your teeth can be overcrowded and you can need braces later on, right? So he's realized that prehistoric skulls don't have any overcrowding. There's no tongues left in, when you're examining things in your museum, but there's bone structure, right? So if the bone structure is normal, like nobody needed braces before the Industrial Revolution. And what happened around that time, moms started not always breastfeeding, and we started having foods that were easier to chew. So losing that ability to chew, it's like use it or lose it genetically. So it's referred to as an epigenetic change. Mm-hmm. Have you ever heard that term?
Yes. I've heard of epigenetics.
So epigenetic meaning we have our genes, but our genes express depending on the environment. Mm-hmm. So a few generations of not breastfeeding, formula was introduced in 1930, and a few generations of not using our jaws to chew made us not have great jaw structure and not have great oral function, and that includes the tongue.
That makes sense.
Yeah.
My mom breastfed me till I was old, so I was like 4.
You're so lucky.
Yeah, I mean, and that was only me. My siblings are older and they were close in age, and I don't know if tandem nursing was like a thing she knew about back then. It's something I considered to do with my own when I had a second, because my daughter was, she was still nursing until she was, 2 plus. And it was only when I got pregnant that I weaned her, and it was against my will. It was a very painful experience for me, and it was against her will as well, which is part of why it was, such a hard experience. But I since I had been at risk of preterm labor my first time around, and I just got this sensation of just more nausea than usual every time she would latch on, which had just never happened up until I got pregnant again. My plan had been to just nurse her until she weaned herself, and if that meant tandem nursing, even though I know that's very demanding, even more so than full-time nursing one, it's 2, right? But I considered it because I really did not want to wean her against, her will, and that was not what I wanted to do either for me. But that's how it happened, and I've read that sometimes they want to start nursing again when the baby comes. It's also it's just so recent. It's not even. It's been a few months since she weaned.
Yeah.
So
if you're open to that, it's totally up to her, really. If you're open to it,
We'll see. Yeah, I don't know how it's gonna go, and I know every child is different, so we'll see how much this one wants to nurse. Because my first, she was just nursing all the time, and then all night long, and it was just like, it was pretty. I mean, it did feel like a very demanding job for me. But that's what I wanted my job to be. I really wanted that. So
that makes me feel so good to hear that. Oh, I love it. Because it is the most important thing you'll ever do. I don't care if I sound like an anti-feminist, because I'm not. I'm a feminist. But it's you deciding that it's that important to you, And can I just say I want to applaud you, because I think that one of the things that attracted me to your account was your pictures of you nursing your baby, and not an infant baby, because we don't see enough of older infants nursing and toddlers nursing. And thank you for doing that, because we need to normalize that, because that is, the natural age of weaning is, as you did, 3 to 5 years old, and that's not for everyone. But in our culture, sometimes we shame people who nurse past 6 months.
Yeah, people think it's weird or something. I don't know, and it's sad. I get comments. I would get occasional comments, of like, why do you post pictures of nursing your 1-year-old or whatever? And it's just like, it's literally the most natural thing a mother can do to her baby. Why would I not? It's part of my daily life. Like, if I'm going to post what I'm eating, why wouldn't I post what my child's eating? Which is she's nursing like all the time.
And you're making it normal. You're making it normal by showing it. So it's so important. My grandson is 16 months old, and he's still nursing, and that's been a challenge. My daughter has been a trooper, because he's, not to get into his story, but it hasn't been easy for her, and she needs to cut down a bit just for her own sanity. So she's going through a little bit like you did with having to do it when she doesn't really want to. He certainly doesn't want to. He would nurse every hour if he could. And it's a challenge, but you have to do the things that feel right to you. And I admire that you realized instinctually the right thing to do, even though it was hard, was to wean. Because we have to get back to our instincts and do what feels right to us,
Right. Yeah. And if we lose our sanity, there's no good for our children in that either. So we need to keep ourselves sane also. So yeah, that's been my pregnancy journey the second time around, which I never knew that could happen, that I could feel, nausea from from her latching on. That was very new to me, and I felt a lot of shame and guilt around it too, because it was just, I didn't prepare myself for that. I kind of had envisioned myself just nursing her throughout my pregnancy and possibly even while nursing the newborn. And so, yeah, I was, I guess I had to, tell myself that I did what I had to do, even though it didn't necessarily feel right in all aspects. It was what I needed to do in the moment. So I gave myself comfort in that.
So when I was practicing as a midwife, if I had a toddler that could nurse, sometimes we used that toddler to help bring mom's milk in. If the newborn was sluggish, we'd convince the toddler to help because they knew how to do it, So, and it was always a blessing to me to know that when there was tandem nursing, that we did have someone that, like, the milk would be there. And the milk comes back amazing. It's again, our bodies are incredible with how we make milk for the babies we need. The babies who ask to nurse, there will be milk there, as long as there's nothing health-wise going on,
Correct.
But that's the other thing, getting back to how we said in the beginning about what to do before the baby comes, to prepare. When you speak to a lactation professional, they'll go over with you the risk factors to breastfeeding difficulties, like low milk supply, and what the risk factors are for low milk supply, which will either help you to prepare in case there will be, or to reassure you that there's no reason why you shouldn't make milk, because there are some risk factors: previous breast surgery, some hormonal problems like polycystic ovarian syndrome. Some people have lower milk supply. Infertility treatments or needing infertility treatments sometimes lessens your ability to make milk because there's some sort of hormonal problems to start out. And other things like diabetes, gestational diabetes, high blood pressure. So that's not to say that if those things are present, you can't breastfeed, but it's more of an important, like, having a plan of what you're going to do. Maybe starting pumping earlier, or doing some hand expression even before the baby comes to be ready to feed the baby, and on an individual basis. So there's things that you can prepare for ahead of time. If you know you're going to have a NICU baby, like some parents know ahead of time, for some reason their baby has to be born early, or if the baby has something wrong that's going to necessitate a separation, you can prepare for that and know what your plan is, so you feel proactive before the baby comes.
Yes. Oh, that's so important. Thank you for bringing up also, because that is many moms' realities that I guess maybe it's not talked about that much. But yeah, NICU babies, you are separated from them for longer than the alternative. And I want to briefly go back to when I was talking about the hospitals and their lack of maybe support and preparation. Is there something that, if you had to just, I know you've said a lot and it's been super helpful. Hopefully everyone has really gotten a good grasp of what they need to do. But there's something that I had another episode, and I had a guest speak about self-advocating. And like when you're pushed the formula onto you and you're very firm on the fact that you want to do everything possible before having to resort to that. What is something that, the women can come in armed with and just kind of stop the push from, the hospital nurses, whatever, trying to, get the formula onto them.
That's a good point. Most importantly, being armed with information. So knowing the fact that all babies are going to lose weight after birth. And I didn't know that before I even had my own babies. I didn't know that babies lost weight after birth. And it's normal to lose up to 10% of birth weight in the first 3 or 4 days and then start regaining. Some babies won't do that much. If a mom gets IV fluids, the baby is going to retain some of that IV fluid. So somebody, say, who has a 2 or 3 day induction, they're going to get a lot of IV fluids, and they're going to be really, really puffy, and the baby puffs up with those fluids too. So after birth, that baby, just like the mom, is going to urinate a lot and lose those fluids, which is going to drop the weight. So say a baby is born at 7 pounds, 5 ounces, but mom got, a liter of IV fluids every 12 hours, which is kind of standard in the hospital, sometimes even more. That baby might have been 7 pounds, 3 ounces before she got IV fluid. So now when that baby loses 2 ounces, it looks like the baby is losing so much weight, but mostly it's the water, the extra fluids that they got. So knowing that it's normal to lose weight, knowing that the baby won't regain birth weight, and we're not expected to be back at birth weight before 2 weeks. So as long as there's a trend upward after those first 3 or 4 days of just 1 ounce a day, which is typical, will happen if you're nursing and nursing is going well, then there's no reason to add formula. The other reason that sometimes formula is given is if the baby's not seeming to make enough diapers. So again, arming yourself with the information that on the first day, babies only make 1 wet and 1 dirty diaper. That's what's expected. On the second day, 2 and 2. And on the third day, 3 and 3. And that diaper, especially the bowel movement, starts out really dark, black, tarry, called meconium. That lightens up. So by day 6, it should be nice and yellow. If you give formula, if you have to give formula for a medical reason, that's one thing. But if you give formula, you have to expect that bowel movement is not going to get lighter because there's iron in the formula, and the iron is constipating, and formula in itself is constipating to the baby, so they don't have those bowel movements. So those are 2 pieces of information to arm yourself with, that it's normal. The other thing is to have other ways, so that if the doctor says to you or the nurse says to you, we're concerned that your baby's not getting enough, we want to give the baby more, the first thing that you should do is give more of your own breast milk if you can. And the colostrum is literally liquid gold. It's the most special fluid in the entire universe, and it's made especially for what that baby needs, right? So human babies need human colostrum. So I even encourage people who don't plan to breastfeed, just give some of that colostrum to the baby, because it's just like a building block of their gut, their flora, and everything good. So you can hand express, and there's lots of videos online to teach hand expression, into a spoon, and just spoon feed the baby, or ask for a little syringe and do it that way instead of giving a bottle of formula. And if they absolutely do need to give some formula, you can give it in smaller amounts. So back to the marketing aspect, we use either 2 or 3 ounce bottles in the hospital. No brand new baby needs 2 or 3 ounces. The first day's feedings are about a teaspoon, right? And we're giving them this much instead of this much. So you can sometimes a little bit of formula. I prefer it to be breast milk, but if it has to be formula, just a little bit is enough to wake the baby up, to let them get the impetus to feed, right? So sometimes they're too tired to feed. Giving a little colostrum, even on your finger, even just hand expressing on the finger and letting the baby suck it off your finger, will sometimes wake the baby up. And I like to do that skin to skin. I always, recommend lots of skin to skin for the first even couple of months, as much as you can. That's the best way to settle a baby. There's lots of skin to skin at birth, if possible, and if not immediately at birth, whenever you're reunited. So back to that NICU baby, right? Say the baby's got to be in NICU overnight, and you didn't get to do skin to skin and have that golden hour in the delivery room where you just spend time skin to skin together. Pretend the baby was just born on that first time you get to be together. Undress from the waist up, take the baby's clothes off except for a diaper, put them on your chest, cover them with a blanket. So if you're separated, and whenever you get back together, pretend the baby was just born, put the baby on you skin to skin, and let them crawl down to your breast or root to your breast and enjoy that closeness together. It's really special. And skin to skin helps milk supply as well.
Amazing. Oh, well, thank you for that information. That's it's really great to know, especially, first timers. We come in knowing very little about all of this. I was blessed with amazing midwives and support system that told me all these things, but had they not, I imagine I would be so clueless, and there's still so much I don't know, right? But I would say being armed with information is just the best you can do to advocate for yourself and your partner, whoever's with you, to also be able to know this information and know your desires so that they can advocate on your behalf as well. I would say that's important.
Absolutely. I mean, I'm a fan of doulas because sometimes your partner might be intimidated by the hospital system. And a doula can act as as a good advocate for you if she knows what your wants are. She will remind you. She's not going to do anything, or she can't get in between you and the medical system, but she can remind you of what you wanted and help give you suggestions on how to approach the hospital staff.
Right.
Yeah.
And
the other thing to know, I think it's important to mention that the jargon now is, yes, of course we support breastfeeding. Everyone says they support breastfeeding, but not everybody knows how to manage breastfeeding, right? So in theory, doctors, even OBGYNs, will tell you, of course we want you to breastfeed. Pediatricians want you to breastfeed and support breastfeeding, but they don't always know how to manage things when things start to get a little bumpy, and are quick to resort to supplementation. And then, one of the things that you spoke about when you were telling me about your experience was that you didn't start pumping. And again, I applaud you for that, because there's this, I think, social media driven need to pump and show large supplies of milk in the freezer and the stashes and all that. And there's no need for that. There's no need for that. And it kind of upsets me sometimes, because not everybody could do that if they wanted to. And it's not always a good idea to do that. And the other part of that, it's one thing if you have to go back to work, you need enough milk to go back to work with. But you're also going to have to pump when you're away from the baby. So you're going to be bringing milk home. And the other thing about pumping too early, if everything is going well, if things are going south, you need to pump to give the baby milk. That's one thing. But if everything is going well, breastfeeding is as simple as it can get. And once we start thinking, oh no, I have to do something, we interrupt that normal flow, that natural flow, and we make it harder for ourselves. Right. You're putting something else into it. Now we're dealing with pumps, and we're dealing with washing the pump and bottles and storage and all that stuff, and timing.
Even before that, choosing your pump. Nowadays, there's so many, which is great that we have so many options,
Yeah.
But I remember I did buy a pump, and I ended up using it very little, just because, as I said, it didn't feel necessary for me. And again, many women maybe have to go back to work, and they have to eventually, pump and do all of that. But I just felt like the simpler, the better. I was maybe partly just me not wanting to overwhelm myself, as you said, with yet another task. It was quite enough feeling exhausted constantly from having a newborn, and then learning, how to be a parent. And so it was just like, I'll just nurse her. And that was the best thing for us. That was how I chose to do it and how it worked out for us. And so I got to say, I feel pretty fortunate in that area. But I was also very adamant about my desire to exclusively, nurse for as long as I could. So
and just, let me turn the tables a little bit. Do you have any questions for me for your second time? Like, say you were coming to me as a lactation consultant. Like, was there anything that you're wondering now, or like thinking about something? Because this is what I do when second-time moms or third-time moms come to me. I'm like, tell me what you would want to change about the first time.
Well, honestly, I'm now questioning if my daughter actually did have a tongue tie, because it was I think unnecessarily painful, and it was because of the shallow latch. That's what I think the problem was. And there was something else that you said that I was like, oh, it was also very smelly. She like pooped a lot. But I was like, this is such a small child, and I have a very clean diet. I like to say, you know, I eliminated dairy. I'm vegetarian, and I was like, it can't be what I'm eating that's making her like fart. This,
that was
like,
what I was going to
smelly.
say. The other thing that does that is dairy, or sometimes vitamins, certain supplements.
Well, I was very
usually,
conscious of like what I was putting into my body because I know, you know, she's nursing from me, and I was like, they smell very powerful, but I kind of just was like, well, I don't know, you know, maybe that's the way they are. And in Spanish, we roll our R's, and my husband can't roll his R's, and that's why I asked if it was like hereditary or, you know, genetic, because I'm thinking perhaps he had one when he was little, and it was never discovered. I don't think he was nursed for very long. And I don't think, as you said, back in the day, it was like very known. So it wasn't like something people like looked to discard. And so part of me thinks maybe she did. And currently, I mean, she's still 2. She's speaking a lot, but she doesn't roll her R's yet. And so I'm like,
and maybe. If she has problems with things that make her certain sounds where she'd have to get her tongue up to the right behind her teeth, you know, like or the other thing to look for is make sure she sleeps with her mouth closed, because if someone's having trouble with their tongue, it shapes the palate, and then they tend to open their mouths to breathe, right? So you want to always make sure, like, baby snoring is adorable, but it's not healthy, you know, so open mouth posture, snoring. And, you know, if she does well with all textures and eats all different kinds of food, that's a good sign. You know, some kids will have trouble chewing and swallowing certain things if they have a tongue tie. But it's not something to, you know, it's not something that needs to be addressed in infancy. You know, this can go as an adult. I mean, I had mine done when I was after 50.
Really?
You know, so yeah. Okay. And mine has more to do with sleep issues and stuff like that. I mean, we could do a whole episode. I don't want to go on that rabbit hole because we're talking about infants here. But I will say that I do observe in grown people, especially some people on a certain team, that definitely have a tongue tie. And I could tell by looking at them that they have a tongue tie. Well, and I'm like, oh, I wish I could tell them, you know.
Well, that's like, now in retrospect, I'm like, I never really like specifically got down to like discarding it, you know. So because in the end, what I had heard about it is, you know, if there was a problem with the feeding, then I would have to really dig deeper and see what the problem was. But since she gained weight so quickly, I was like, well, she's getting what she needs, you know?
And your support people were very supportive, but we don't learn about tongue tie in school. So that's why I know more about it, because I learned about it after school. Even in training to be a lactation consultant, I didn't learn about tongue tie, except for the anterior tie, where it's attached right at the beginning of the tongue and you can't lift the tongue at all. That's what we learned about in school.
Okay.
We didn't learn about the further back ties or the shorter frenum that cause problems, you know, even though you can't really see it unless you know how to examine for it.
Okay.
But I like to do a functional assessment. I don't look at what it looks like. I like to, you know, observe what's going on.
Right. So, yeah, because as you say, if it's apparent physically, then there's one thing, but sometimes it's not. So I have, you know, learned a lot from you. So now that going in this time, I will know what to kind of the signs that are there.
Absolutely.
And then I might have to call you. I might have to call you.
I also have an online course for parents. You know, I'm not saying this to plug myself, but if somebody can't find local help, I have a very affordable online course that takes you from, what if I think my baby has a tongue tie? How do I know? What do I do? And all that. Because this is often can get to be a complex situation where it's not just about having the frenum released. And I usually refer to dentists who have a laser because it's a quick office procedure. But sometimes when a tongue has been tight for a long time, we have to retrain the tongue. And there's exercises to do and preparation to do, and making sure, you know, if there were feeding challenges, we want to make sure that the mom's supported in how she's going to feed the baby immediately after the procedure and making sure her milk supply is optimized and things like that. So all of that is in the parent course, but it's also important if you're looking for someone to find someone who does work with a network. So you wouldn't want to just say, oh yeah, my baby's got a tongue tie, go to the pediatrician. They recommend an ENT who does a quick snip. That may or may not solve the problem, because the problem is often deeper than just that quick snip. You have to do other things to make things easier. And also you want the support through the procedure. Right. I have a whole, my newest platform is like, we have to think about what the family is going through. And sometimes a quick early procedure isn't a good idea because of all those complex things that are going on immediately following birth. We want mom to recover, Mm-hmm. We want mom to be stable and feeling a little bit in control again, and having her milk supply optimized and having the baby fed. Maybe, we have to bottle feed the baby for a couple of days or make a plan, depending on this situation, to make it the least traumatic as possible for the family going through it. Sometimes as medical professionals, we say things like, oh yeah, no big deal. Just, let the baby have the surgery. And that could be just the idea of your baby needing a procedure mm-hmm. can be traumatizing to a parent, right? So I like to honor that. And the midwife in me wants to do the least we have to always, mm-hmm. as least intervention as possible. So there's a fine line into not treating or treating too fast, right? So there's mm-hmm. that. And that's, my life in a nutshell.
Well, you have been such an insightful guest. I appreciate your time and sharing your knowledge and experience and wisdom with us. Yeah, I hope to have you back perhaps. I feel like there's so many more topics we could discuss. So I'll end our episode here, but I just want to thank you again. And all of my listeners, I think they'll have your information definitely when I post our episode. And I will reach out to you come baby number 2 if I have any issues. So thank you.
Thank you so much. It's been a pleasure to chat with you today.
Likewise.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.